One of the things that I frequently say is that if you are taking a look at patients and assuming a heteronormal sexuality when you're having that conversation with them, you're not really doing service to the patients. As physicians and primary care doctors, we're under increasing pressure to really provide primary care services at a very rapid rate by seeing a lot of patients very quickly. And what we really need to do is we really need to take those few minutes to stop and have a discussion about their sexuality with an individual. There are screening questions that you can ask, and some recommended questions is what is your birth gender and how would you identify your gender now, your gender identity now. And I think that really having these conversations with our patients, asking them if they're young, are they holding hands with boys or girls? Do they like boys or girls? Are they interested in men or women? Are they interested in transgender individuals? Creating open-ended questions is something that's very important for us to do in healthcare. And historically, as providers, we really haven't asked the questions. We haven't really looked for this information. A provider would not consider not asking about, do you smoke cigarettes during an annual evaluation? But asking a question about someone's sexual orientation may not be part of the standard conversation that a provider does have in an annual evaluation, and that's something that we should really work on. The reason being is things are different. If you're doing a HIV test and a urine test for gonorrhea and chlamydia, and the person is not having sex by using something that will be determined by urine, then we need to do a better test. We need to be able to do an anal test for gonorrhea, chlamydia, or an oral swab. And so we really need to be looking for sexually transmitted infections based off of the risk that the patient has, based off of their behaviors, rather than based off of our perceived assumption of what their behaviors are. I'm a subspecialist, and so I primarily see people regarding immunological issues, but I think that it's important that in a primary care setting, that based off of someone's age, you ask age-appropriate questions to the individual to kind of see what's going on. It never hurts, and sometimes I'll get a laugh from a patient when I ask the question. I said, so are you interested in guys or girls? And some patients will laugh and say, well, of course it's whatever, but a lot of the times people say, well, I kind of am interested in both, and sometimes I have this, and sometimes it's that. And I said, well, how many guys have you been with, and how many women have you been with? And I think asking these kinds of questions and really opening the door to be able to have these open conversations allows you to better understand your patient, and it allows you to better understand what practices that patient is participating in and how you can address their overall needs as a person, and as their sexuality is addressing, and regarding their sexual health. Sexually transmitted infections is one group. I think that that's an important piece. I think we also need to talk about other issues regarding domestic violence that can be increased. I think there's other issues regarding a lot of psychological issues if people are being kicked out of their houses or being shunned by their families due to their sexual orientation or the coming out process. So I think there's a whole host of issues that are there regarding housing, homelessness, regarding insurance, regarding sexual orientation, regarding domestic violence, regarding sexually transmitted infections. And I think there's a whole host of things that we need to look at. The American Academy of Physicians actually released the second guide from Fenway this past year, and it's a phenomenal resource that's able to address a lot of the health issues for the LGBT population in a way that adds equity to their health care. In a lot of ways, they're a sexual minority, much like we have others that are racial or ethnic minorities. And we need to make sure that just like our healthcare is addressing racial and ethnic minorities and providing culturally competent healthcare from that perspective, we need to address those who have sexual minorities as well and making sure that their healthcare needs are met equitably. We're physically based in Great Neck in the North Shore of Long Island, and I also provide low-threshold medical care at an LGBT organization 1/2 day every other week in Belmore in the South Shore of Long Island. We have a lot of patients that come in from Queens. We also have patients that we're seeing from Nassau and Suffolk counties. We're seeing Queens-based patients, and we even have a few patients from Brooklyn and a couple that make it into Manhattan. So they kind of come from all over. We had a patient population that was approximately down to 40 HIV-infected children and young adults that we had about 5 years ago, and recently our population has gone to about 150 HIV-positive individuals. And when we started providing HIV prevention services, we were actually able to increase the patient population and be able to really provide resources that we now have over 60 patients in care for receiving HIV prevention services. And we're able to expand that, we hope, due to additional funding, even beyond that to several hundred patients this coming year.